Most practice owners think a no-show costs them the value of that one single appointment. A $200 cleaning is costing them $200, a $300 crown prep is costing them $300. Whatever is on the schedule is they're thinking is costing them. That's not even close to the real number. The actual cost of an empty chair is 3 to 5 times what most owners think it is. And once you see the math, you will never look at the schedule the same way again. So this is leak number 2, broken appointments. Now, if you haven't watched the last week's episode on unscheduled treatment, you can watch that with the link in description, but stay with me right now because this one is going to change how you think about every cancellation that comes through your door. Let me walk you through what actually happens when one patient misses one hygiene appointment, because this is the part nobody talks about, and I want you to listen to this closely. If the patient doesn't show up, you didn't lose just $200 cleaning. The hygiene visit was an exam, and that exam where your provider catches, the cracks in molar, the flagged early period, spots, crowns that needs replacing. The average hygiene exam, generate a lot more than what cleaning generates in restorative treatment on top of cleaning. So you already are not at $200, you are at somewhere around $1,000, but it gets worse. The patient missed their cleaning, no exam happens, the crack doesn't get caught, the crown never gets diagnosed, the patient never schedules a follow-up, they start drifting. 6 months later, they're due for a recall, but they already missed once. They feel awkward about it. The reminder goes out, they ignore it. Now you have lost 2 hygiene visits, a possible restorative case, and a patient who might never come back. Every future patient they would have referred to. One broken appointment, one cascade, the real cost is $200, is at somewhere between $900 to $1,500 if you take in consideration everything downstream. Now I know what some of you are thinking. Hey, our patients are the problem. They're irresponsible, they don't value their time. But I'll tell you this, blaming the patients is not gonna fill the chair. It's not gonna recover your revenue. It's just gonna make you feel better about the problem you're not solving. Practices I have seen that got their no-show rates down from 15% to 5%, they didn't do it by lecturing patients. They didn't put up signs, they didn't charge cancellation fees, they built systems. And the systems did the work for them. If your no-show rate is high, the patient are broken. But I'll tell you, your process is broken. So what do the best practices actually do to reduce their show rates? And they do this in 3 different layers. The first one is prevention. The second one is filling the cancellations. The third one is recovering as soon as the appointment is missed. So let's talk about one of them in detail here. The first one is prevention. How do you prevent? You prevent this with automated reminders. Not one reminder a day before, but a sequence. You text them 72 hours ahead of appointment, you text them another text message 24 hours ahead, and on the same day morning with your address, making it easy for them so that they don't forget about it. Each one of them would have a confirm or reschedule link built in. So the practice is running a 3-touch sequence like this sees their no-show rates drop 30 to 40% from that one sequence alone. Layer number 2, filling a cancellation. So cancellations are going to come in any day, but the question is how fast can you fill them? So best practices have a quick fill system. As soon as the cancellation hits, system texts 5 to 10 patients from waiting list. The first patient to confirms gets the slot, and this happens in minutes, not in hours. So most practices try this manually and it's too slow. So don't even try that. By the time someone starts calling, the time slot have already passed. And layer number 3 is your recovery system. So within 1 hour of a missed appointment, patient gets a text and it says something like, hey, we missed you today, do you want to reschedule? On day 2, another text with specific time. On day 5, there's an email. On day 10, there's a phone call. And I'll tell you, some of you are thinking that's too much chasing, but I'll tell you this, you're not chasing, you're making it easy for your patients to come back. So these are the 3 layers. You're preventing by our automated reminders, you're filling your cancellations as fast as you can, and the third part is you're recovering the patients that have missed the appointment. The practices running all these 3 layers are at 95% of their schedule utilization. Now, everyone else is just hoping the patients show up. Now, one more thing nobody talks about: repeat no-shows. What do you do about the patients who consistently are repeat no-showers? So about 10% of your patient costs over 60% of your broken appointments. You should know your patients that cost 60% of your broken appointments. Same people over and over, and they get treated exactly the same as everyone else. Now, the best practice is handle them differently, not punitively, but strategically. Flag patients, with 2 or more appointments missed or no-shows in your system. More confirmation, design more confirmation touches for them. Design more reminders for them, earlier reminders, and maybe a personal call a day before, and get a verbal confirmation. Some practices double book these slots. Some requires a deposit. That's all up to you. But the point, you don't punish. It's to stop pretending that every patient behaves the same when the data says they don't. Handle your repeat no-shows differently. Watch the half of your problem will disappear. Now, let's do the math. You're at 12% of no-shows. Cut it down to 6%, which is exactly what happens when these 3 layers are applied. You're recovering 1.5 empty chairs a day, $900 to $1,500 per chair. That's $30,000 to $50,000 a year. That's the money you were losing. And now you're not. Same patients, same schedule, same team, just a system that prevents, fills, and recovers. Unlike marketing, this costs you nothing. These patients were already on your schedule. You're just stopping the leak. That's leak number 2, broken appointments. An empty chair doesn't cost you 1 appointment. It costs you appointment, the diagnosis, the treatment, the recall, and the referral. 3 to 5 times what most people think. If you want to know your actual no-show rate and what's costing you across all 5 leagues, we built a quick assessment tool on our website. So take a look at that. I'll put the link in the description. Take a look at that. Go through it. It just takes 2 minutes. So next week, I'm going to talk about leak number 3, your hygiene drop-off. And this is the one silent killer. Most practices don't realize that they're losing patients until they look at the numbers. 40% of hygiene patients are quietly disappearing. They don't tell you they're leaving. They don't switch to another dentist. They just stop showing up. And by the time you notice, they have been gone for a year. Next week, I'll show you exactly why this happens, what it really costs, way more than the cleaning, and how the best practices bring them back. So see you. Take care.